So, dear students, the topic of lecture is the relationship between the medical staff, the patient, and his family. And for the very beginning, let us discuss the psychology of the relationship between doctors and nurses. Inherent in ethical decision-making is the application of ethical values and principles in difficult and conflicting situations that nurses may face in specific circumstances during the practice of their profession. Nurses are at all times expected to observe and apply fundamental ethical principles in their interaction with healthcare users. Such ethical principles include, but not limited to, the following. First of all, the principle of social justice. It means nurses are at all times expected to act fairly and equitably where there is competition of interest among patients, groups, or individuals. Such interests may be, amongst others, related to access of healthcare resources, issues linked to prioritizing care, or any situation that may be perceived or experienced as unequal. Nurses should therefore pursue justice and advocate on behalf of vulnerable and disadvantaged healthcare users and should be able to justify their decisions and actions. The next principle of non-maleficence. This requires a nurse to consciously refrain from doing harm of any nature whatsoever to healthcare users, individuals, groups, and communities. Principle of beneficence means nurses are required to do good and to choose the best option of care under given circumstances and to act with kindness at all times. It gives expression to compliance with the duty to care as a professional practice imperative. The next principle is veracity. This principle requires the nurse to act with truthfulness and honesty and to ensure that the information provided to and on behalf of the healthcare user is always in the best interest of the healthcare user. The principle of fidelity. This entails adherence to factual and truthful accounting and balancing that with respecting, protecting, and maintaining confidential information pertaining to the delivery of health care, including health records or healthcare users. The next is altruism. It means nurses are at all times expected to show concern for the welfare and well-being of healthcare users. Their nurses are to be mindful of the fact that wishes and actions of healthcare users may be in conflict with the values and principles of the code, e.g., where healthcare users refuse treatment to the treatment of their health and that of others. Autonomy. This means respect for the autonomy of eligible persons in plural, which means healthcare users, to make their own decisions and choices in matters affecting their health. Caring means nurses are required to demonstrate their art of nurturing by both applying professional competences, and positive emotions that will benefit both the nurse and the healthcare user within harmony. Colleagues refer to other nursing practitioners, students, members of an interdisciplinary health team, support staff, and employers in their working environment, as well as all other individuals who are considered as colleagues. Ethical principles must be applied not only in the interaction between the nurse and healthcare users, but also between the nurse and other colleagues, regardless of hierarchical status, level of knowledge, or professional discipline. The disciplines of nursing and medicine are expected to work in unusually close proximity to one another, not just practicing side by side, but interacting with one another to achieve a common good, which means the health and well-being of patients. This selective review of literature addresses some of the issues arising from the frequently controversial subject of the nurse-doctor relationship and actually seeks to draw out the principal themes emerging from the application of sociological theory to the nurse-doctor relationship. The next important item of our lecture is traditions of humanism in the medical worker. Humanistic medicine is an interdisciplinary field in the practice of clinical care aimed at addressing the problems of contemporary health care. The fundamental principles of humanistic medicine are open communication, mutual respect, and emotional connection between physicians and their patients, termed relationship-centered or patient-centered care or patient-centered approach, in contrast to case-centered or disease-centered, for instance. In many countries with modern medical technology, healthcare systems are facing enormous difficulties in meeting demands such as distributing resources and providing adequate care due to the large number of patients in need. As these healthcare systems become larger and more developed, both practitioners and patients experience dehumanization, and healthcare practitioners often experience high levels of stress and emotional burnout because of that. Doctors facing a large number of patients are not giving individual patients the attention they need, resulting in patients seeking alternative treatments. The rising costs of medical services, technology, and medication are becoming unaffordable for many patients, preventing these individuals from receiving adequate health care. Studies described in literature have shown that poor doctor-patient relationships result in lawsuits against healthcare providers, and these lawsuits have become a major burden to medical personnel and have risen in both number and cost. And the crux of humanistic medicine is holistic healing, defined as treating not only the body, but acknowledging the soul as well. Humanistic medicine attempts to complement physical recovery by connecting with patients through empathy, patience, and compassion. It is the humanistic belief that the part of one's suffering during illness stems from the feeling of isolation from other human beings while in a weakened state. By re-establishing this connection, true healing can begin to take place. Among the approaches used to encourage the practice of a more humane medicine are narrative medicine and patient empowerment. Narrative medicine is a way of educating physicians, nurses, and other providers that uses storytelling and active listening to emphasize the humanity of patient and provider, enabling the physician to practice medicine with empathy, reflection, professionalism, and trustworthiness. Patient empowerment seeks to create an equal partnership between doctors and their patients. Both of the practices emphasize that importance of the human experience in the practice of medicine and help to ensure that the humanity of the patient is not obscured in a moraines of lab results, patient charts, and insurance regulations. Humanistic medicine strives to create ideal and balanced care that sacrifice neither cutting-edge science nor the gentle art of caring relationships. Important item of relations between staff are relations between different parts of medical workers. Organizational ethics provides the involving the intentional use of values in decision making, and such scientists as Winkler and others proposed four substantive principles of organizational ethics to guide decision making based on values inherent to the organization's relationships with key stakeholders. Other values have also been argued to be important for creating an ethical organization. It means humaneness, reciprocal benefit, also trust, gratitude, dignity, service, and stewardship. Trust has been emphasized by several authors as a key to organizational ethics effectiveness in healthcare organizations. These and other values are often articulated in an organization's mission, value statements, code of ethics, policies, and staff orientation and performance evaluation processes. Ethical decision-making processes are also essential to organizational ethics. Organizational decision-making is often fraught with moral uncertainty about what ought to be done in the context of competing stakeholder interests, conflicting values, and limited information. Ethical decision-making process helps to establish the ethical legitimacy of organizational decisions by facilitating agreement around how decisions ought to be made. Key procedural values include openness, transparency, inclusiveness, empowerment, and reciprocal accountability. Ethical processes are important for establishing institutional trust and promoting constructive stakeholder engagement around organizational decisions. Although an organizational decision may not favor a stakeholder's interests, the stakeholder may nevertheless be able to accept the decision if the decision-making process is ethical. One prominent process model is Daniel and Sabin's accountability for reasonableness framework, which is described in details in publication since 2002. When integrated into organizational mechanisms and structures, these substantive and procedural values can contribute to the establishment of strong ethical climate and culture in the organization. The field of business ethics offers additional concepts and tools to address the business aspects of healthcare, to importance of collective responsibility for mission fulfillment, and the unique value-creating activity of organizations as compared with individuals. For example, stakeholder impact analysis involves identifying all stakeholders groups and interests, ranking and weighting the stakeholders and their interests, and assessing the impact of a purposed action on each stakeholder group. Several bioethicists have proposed stakeholder impact analysis as a tool to facilitate organizational ethics decision-making in healthcare organizations. Ethics relationships in the medical team are important item for organizing good climate in the medical establishment. And first of all, it is important to concentrate on organizing partnership between provider and client. Providers and clients should view healthcare as a partnership in which each party contributes to maximize end results. Mutual respect and trust and joint decision-making will result in greater likelihood of a positive outcome. Both provider and client must realize that even though the provider is the medical expert, both are responsible for the outcome of the interaction, because nowadays client has autonomy too, and so they are both responsible for the result of treatment and care. The patient must disclose all relevant information in order for the provider to determine a proper diagnosis and to prescribe appropriate treatment. The provider must interpret and analyze the information received and effectively explain their condition and treatment options to the patient. Both should make decisions about treatment regimes, with the client making every effort to comply with the prescribed treatment and any necessary lifestyle changes the treatment implies. Providers should foster an active role for patients in their care and treatment process. Providers also should encourage active questioning and interacting during office visits and should involve patients in their own healthcare regimes. Important item of organizing this relation is creating of atmosphere of caring. Patients need to believe that their provider cares about them and is committed to their welfare. Both verbal and not verbal communication help the provider convey interest and concern to patients. Being attentive, making eye contact, listening and questioning thoroughly, and demonstrating understanding and empathy makes patients feel important and worthy. On the other hand, being brag or appearing busy or distracted makes patients feel insecure, anxious, or fearful of their relationship with the provider. Effective bringing of social distance is part of important communicational skills, and before describing that, I'd like to show you a brief video which actually propagates and demonstrates the bad example and good example of behavior between patient and client. So please watch.
Communication techniques. Evaluate these 2 vignettes for different therapeutic techniques and communication barriers. Consider the patient's response to each encounter.
Come in. Are you a nurse?
Mrs. Miller, I am a nurse.
Can you get me some pain medication? That other nurse last night was just awful. I only saw her once at the beginning of the shift, and I'm really, really uncomfortable. And I just don't feel good at all. Is there any way you can give me some relief?
Well, first off, I need to do a complete assessment on you before I give you
How long will
payment.
that take?
20 minutes. Because
Well-
I'm very busy, and we have
But
other patients. other than
I'm
you.
very uncomfortable. Is there any way? She didn't do anything for me last night.
All right. Well, on a scale of 1 to 10, 10 being the worst pain you ever had, 1 being no pain, or 0 being no pain, where's your pain level?
8 or 9, maybe going more. It's just, I haven't had anything to give me any relief. I haven't had any sleep last night. I kept buzzing the buzzer and she just wouldn't come in. Well, can you do anything for me?
Let me go check your medication orders.
Can you please hurry?
Well, you're not the only patient I have today, so I will do it as fast as I can do it.
I hope so.
All right, I'll be back.
If not, I'm going to talk to your supervisor.
Okay, well, I don't think that's really necessary.
It may be, I hope not.
Okay, well, I will go check right now for your pain meds. I'll be back.
Thank you. Come in.
Hi. Mrs. Miller, you were resting. I didn't know if I wanted to disturb you or
I almost
not.
went to sleep there for a minute. I
Uh-huh.
couldn't believe, because I didn't sleep very well last night at all. I was up most of the night. And so after you gave me the pain medicine, I felt a little bit better, and I almost nodded off.
Oh, well, if you need to nod off, go ahead and we will
Well, I probably won't, because they're gonna do it for some kind of procedure.
they are, this afternoon. You're gonna have that biopsy done, so
Mhm.
they'll come and get you and take you down.
Yeah, I hope that'll be okay.
Okay, are you clear on everything
Well,
for the procedure?
will it hurt?
Well, they'll put you to sleep. We had talked before, you took your little nap, they will put you to sleep with anesthesia, and it should not hurt during the procedure. After the procedure, there could be some pain, but when you get back to the floor, and also right after you get out of surgery, the nurses in the receiving room will make sure that you're medicated, and we'll get you back to the floor, and I'll make sure that you have your pain meds.
When will we know the results?
They take a couple days, and so your doctor will receive them, and then he will be sharing those with you.
Okay, I'm just kind of worried. I mean, I just don't know what's gonna happen.
Yeah, I'm sure it's not a easy thing right now. The unknown is always a bit scary, isn't it? It is.
It really is.
Okay.
And I don't want to bother anybody, but I just, it is kind of scary.
It is pretty scary. So we'll just hang in there, and I'll be here today again to care for you, and I'm on tomorrow as well.
Oh, that's wonderful.
So, and I'll be sure to express to the night nurse at shift change that you have you have some concerns about this?
Is the same nurse on tonight?
You know, I'm not sure, but
Because I didn't like her at all.
you did.
You know, she was rude, she was rough. I was just, I just wanted to throw the pitcher of water at her.
Really?
Yeah, I mean, she didn't come back. When she did, she just stuck her head in and left, and I just, I don't know why she calls herself a nurse.
So you felt like you maybe weren't cared for very well?
Oh, no, I wasn't cared for at all. I mean, she came in and she did a really quick kind of up and down thing, and it was really rough. And then I asked for some medication, and she didn't bring it back, and she stuck her head in and said, "Glad everything's okay," and went back out again. And I yelled for her, and I buzzed for her, and she never came back at all. I mean, and I couldn't sleep, and it was really noisy. I don't know, there was a bunch of noise down the hall, and, you know, she was just awful. I mean, it's terrible. She's one of the worst nurses I've ever seen.
No, I am so sorry that that happened to you last night, and I'll be sure when I give a report tonight to whoever that nurse is coming on, that your needs are met.
So thank you for being
Okay.
so good.
You know, you are welcome. You're welcome, because it's hard enough to be in the hospital, let alone have all that other stuff going on.
Yes.
Okay, all right, so I'll be back. You try to rest, all right? Anything else you need?
No, I think I'm just gonna put the bed down.
Okay, all right, your call light is here in case you need us.
No, I can't have any water or anything, right?
Not right now, but I'm gonna go grab that other pillow real quick for you, and I'll be right back.
Thank you.
So you can appreciate the importance of empathic behavior of the medical professional. And now let us discuss the effective bridging of social distance. Social distance refers to the social, cultural, economic factors that make people feel they belong to different class ties. Education, economic status, class, race of ethnicity, maybe gender and age may all contribute to how close or distant two individuals feel about each other. For example, an illiterate person, a woman maybe, and a young, highly trained city-dwelling male physician who share the same language and were raised within miles of each other are still different apart society, and clients bring to medical visits a whole range of emotional, social, cultural, economic, educational, and psychological traits they affect. Which affect their communication, and social distance should not impede good communication, and providers must realize that many people, even those in their own circles, may not be conversant with their language. Therefore, they should strive to bridge any social gap that might exist between them and their clients, and establish an open dialogue, a partnership, and an atmosphere of caring, which is important. Clients must also do their part to bridge their social distance by being candid and communicative, but it is not possible to require this from clients. It is only possible to create preconditions for all that. Social networks refer to those interpersonal relationships that bind people together, typically consisting of family, friends, neighbors, colleagues. Social networks influence differently depending on the individual and his or her environment, a person's desire and ability to understand and comply with professional advice. For example, in some societies, the mother or mother-in-law is a key decision maker in the extended family. Therefore, teaching the young woman about the benefits and methods of birth spacing may be ineffective in her mother or mother-in-law is uninformed or opposed to this practice. Similarly, in a home where a woman cooks for the whole family, dietary recommendations that could enhance her health may not be put into effect if they interfere with the family's culinary customs and tastes and so on. The effective use of verbal communication is one more important question because verbal communication consists of spoken and written words people use to convey ideas. And in a healthcare encounter, the choice of words clients and providers use greatly influences how well they understand each other. The medical jargon physicians use to describe symptoms and treatments allows them to communicate clearly and precisely with other clinicians. However, because their scientific and clinical terms may be confusing to patients, their use of such terms with patients is inappropriate. Patients communicate during medical visits in their particular dialects, accents, cadences, and slang, often making comprehension difficult for providers from other parts or regions of the country, for instance. And patients also describe health problems in peculiar ways, often reflecting their unique perspective on the illness origin or severity. Sometimes local perceptions can influence the way a patient describes their illness onset and symptoms. For example, if diarrheal disease are common in their area, patient may not report symptoms of this disease unless they are quite severe. Because they view the symptoms as the routine, patients simply neglect to mention them. For the provider, however, detection of early symptoms, even mild ones, is important in making proper diagnosis and for developing appropriate treatment regimes. It is important also to use simple language, medical jargon, prevention. The clinical spectrum, for instance, of cholera is broad, ranging from inapparent infection to severe cholera gravis, which may be fatal in a short time period. After an incubation period of 6 to 48 hours, there is an abrupt onset of watery diarrhea. Vomiting often follows in the early stages of the illness. Signs of severity include cyanosis, tachycardia, hypotension, and tachypnea as well. The symptoms and signs of cholera are entirely due to the loss of large volumes of isotonic fluid and resultant depletion of intravascular and extracellular fluid, metabolic acidosis, and hypokalemia. And because of that, the collecting of correct, precise, and early information about symptoms is really important item. There is also importance of effective use of nonverbal communication. Words express only part of a message being conveyed. Tone, attitude, and gests convey the rest. Avoiding distractions such as answering the telephone during a patient's visit or scribbling notes on other cases and appearing fully attentive, communicative, positive messages to client. Smiling, listening thoroughly, sitting on the same level as the patient also enhance interaction. Much non-verbal communication is specific to cultural customs. For example, while in some cultures direct eye contact is sign of positive regard and respect, in others it is deemed improper or aggressive, and particularly with members of the opposite gender. Also, while in some cultures physical contact during a conversation is considered a sign of affection, in others it might be construed as highly improper. What is important to remember is that all forms of non-verbal communication convey a message. Often simple gests by a provider such as warm greeting or thoughtful question can help put the client at ease and enhance communication. Such actions do not require great effort but can have significant results. Following is an example of nonverbal communication conveying a positive message. For instance, nonverbal communication can have as great an impact as verbal communication, but can be more easily misinterpreted. Thus, it is important for healthcare providers to be aware of the non-verbal messages they convey to their patients and of those their patients convey to them. One more important item is opportunity for patients to speak about their illness. Their medical visit should provide ample opportunity for a patient to describe his or her illness. Storytelling has its own healing value. In that it provides patient with a release and opportunity for insight and perspective. It may also afford the health provider the insights needed to understand, interpret, and even explore the significance of the symptoms and clues the patient provides. A patient's comprehensions and feelings about a medical problem may be extremely important in prescribing appropriate treatment. A great deal of distress, for example, may stem from the patient's perception about the seriousness of his or her illness, not from its actual seriousness, but just degree of stress of the patient because being ill. Providers should not minimize a patient's anxieties, but strive to alleviate them. All the factors described above have been shown to enhance communication between patient and provider. However, the fact that providers follow individual approaches increases the complexity of formulating a communication skill program. To change provider behavior in concrete ways, the above factors must first be broken down into concrete skills and behaviors, as actually is illustrated in this lecture. And the three types of interpersonal communicational skills include such items as caring and social emotional communication. It means that the objective of caring or social and emotional communication is to establish and maintain a positive rapport with the patient throughout the encounter. Report means the exchange with information and certain interaction, certain kind of interaction or pattern of interaction. This is an integral part of all interpersonal communicational skills which enhance patients' disclosure and compliance. At second, diagnostic communication and problem solving. This is the objective of diagnostic communication, which is for the patient and provider to share all the information needed for accurate diagnosis and appropriate treatment prescriptions. And also, it is important item is counseling. It means the objective of counseling is to ensure that clients understand their conditions and treatment options. Counseling helps them to follow treatment regimes and behavioral change recommendations by ensuring that these are comprehensible, acceptable, and feasible. Counseling emphasizes making decisions together with the client and helping solve actual and anticipated problems. A provider should convey expressions of caring at the outset of the encounter when a rapport with the client is being established. Rely on diagnostic or problem-solving techniques during the history-taking portion of the encounter and use counseling skills at the end of the encounter to explain treatment and provide health education. However, all three approaches may be applicable throughout the encounter. Within the broad category of each approach, specific communication techniques or behaviors can be identified and can be taught and accepted as special professional, actually essential professional skills. A caring behavior emphasizes respect for patients and recognition that their concerns are important. Actually, demonstration of understanding of their importance. This is very serious and powerful precondition just to begin communication and to create this rapport. Healthcare providers should display caring throughout the medical encounter in order to establish a trusting relationships and good rapport with the patient. Frame the encounter means set the tone for the interaction by greeting clients in culturally appropriate ways that communicate openness and concern. For example, the provider might frame an encounter by saying, "Good morning, Mrs. N. My name is Dr. M. I'd like you to feel free to tell me about any health concern you have," or something like that. It's actually a very good and polite beginning for the interview. Necessary to use appropriate non-verbal communication as well. It means to be sure that your body posture, eye contact, gests, tone of voice, manner and attitude are appropriate and conducive to dialogue with the client. For example, a provider who is scribbling notes on a chart when a patient enters might put down the pen, close the chart, and stand up or lean forward as he greets the patient. This shows that the patient, he or she has the provider's full attention, and it is very important for the very beginning. Solicit feelings. Invite patients to talk about how they feel, both physically and emotionally. A provider might ask a patient who is describing symptoms of her headaches, how do the headaches make you feel? How do they affect your other activities, for instance? One more recommendation, show positive regard. It means show clients explicitly and implicitly that they are respected and valued. For example, a provider might show positive regard for a patient by being cautious, smiling, asking, it means usually not very bright smile, but social smile, asking the patients whether he or she is satisfied with the care received so far, or complimenting the patient's efforts in seeking medical assistance, or following treatment recommendations. Positive regard is especially important when dealing with conditions that may have a social stigma attached to them, such as tuberculosis or AIDS syndrome. It is also helpful to bridge any social distance between provider and client that might be based on age, gender, social and educational status, maybe race, religion, ethnicity, or some other factor. Validate the patient's experience and efforts means recognize the patient's experience and efforts in an honest and um, straightforward manner. This may be done through statements of concern, empathy, or legitimizing that show the provider's cares about the patient and his or her problem. For example, when dealing with a hypertensive patient who does not take his or her medicine regularly, a provider might say, I'm concerned that you are not taking care of yourself. This is likely to be more effective than scolding. And statements of empathy show that the provider understands and shares the patient's feelings. Legitimizing statements validates the patient's feeling. For example, a provider might tell a patient who is nervous about surgery, I understand that you are worried about this operation. Or when counseling a cancer patient, a provider might say, it's easy to understand why you feel afraid and angry. Most people in your situation feel the same way at first. One more skill is echo patients' emotions. This means help patients express their feelings by echoing them. For example, when a patient says, I've been feeling very depressed lately, the provider might respond with, it sounds like something is really getting you down. This technique provides the patient with an invitation to elaborate further on the topic and to explain what is the problem, what seems to be the problem. Express support and partnership means to let client know you will work with them to help them get better. A provider might say, I'm going to use all my skills and expertise to help you get better, and I'm counting on you to do your part to take care of yourself. The next skill is to give reassurance. It means encourage and reassure clients about the outcome of their condition. For example, a midwife might say to a patient, I know you're feeling a lot of pain and anxiety right now, but tomorrow you'll feel much better and you'll have a new baby to take home with you, for example. In reassuring patients, it is important to be honest and realistic about the medical prognosis and to avoid premature or unjustified reassurance. If to discuss the problem of diagnosis making and problem solving, necessary to point attention that these skills help healthcare providers gather critical information for diagnosis. Use of data gathering skills enables them to improve their accuracy and effectiveness in performing this function. The skills involve a variety of questioning techniques designed to encourage the patient to talk about all aspects relevant to the problem. For instance, such technique as listening attentively and actively. It means use gests to show patients they have your full attention and ask relevant questions to indicate your understanding of what they say. You may want to face patients and note or comment occasionally as they describe their medical condition. One more skill, encouraging dialogue. In addition to yes-no questions, you may ask patients open-ended questions that encourage them to provide details about their problem. Often, one open-ended question will elicit a response that covers several yes-no questions. For example, instead of asking a patient, do you have a fever? Do you get headaches? Are you nauseous? You may simply say, tell me about any pain and discomfort you've been feeling. And patient will describe. Once the patient describes the condition, you might need to ask one or two yes-no questions to supplement their information. Important skill also is to avoid interruptions. It means don't interrupt patients when they are speaking. Necessary to have some patience, to the doctor to have some patience, and wait until patients have finished their thought before asking a new question. It means to give question in a proper moment. And also, it is good to avoid being interrupted by the telephone or other distractions during a patient's visit. Also, the good skill is to avoid premature diagnosis and resist immediate follow-up. It's better to wait until you have listened to the patient's full story and have asked all the relevant questions before determining a diagnosis and treatment. The patient's first complaints are not always the most important ones. Hastily conclusions can lead to diagnostic error. For example, when a patient reports headache pain, resist the urge to immediately assume that ailment is minor and to prescribe pain relief medication and stop conversation. It's a premature decision. Instead, you might say, tell me more about how you're feeling. Often a simple cure for headaches is all that is needed, but at other times the client might respond, I'm so worried about my feeling and upset. There are times when I don't feel like getting out of bed and feel like I could die. And such a case warrants further inquiry into the psychological and physical causes of the condition. One more recommendation is to encourage patients to provide more information by asking questions or inviting them to continue speaking. For example, the provider might use phrases like "tell me more" or "please go on" to help patients to continue their thought and finally to express all the information which may be essential. It is necessary to be able to ask about causes, and don't forget to ask about causes. It means to help patients share more information about their condition by asking their opinion on the causes of the ailment and what they think might help them. This technique will provide information needed to make a diagnosis and help providers evaluate the patient's understanding of the illness. One more important item of communication, this is counseling and education. These skills enhance providers' ability to explain to patients their conditions, the circumstances of their illness, diagnosis, and treatment options. Providers should remember that patients' compliance with treatment regimes depends on how well they understand the nature of their illness and how they feel about the prescribed treatment. These skills, this kind of skills include, first of all, ability to explore patients' understanding. It means that it is necessary to find out patients' opinions of their illness by asking how they contracted it, whether they had the problem before, and what they did about it at that time. For example, if a mother is seeking care for a child with diarrhea, the provider might ask, how do you think children usually get diarrhea? And how do you think your child got it? And how did you take care of it in the past? It actually makes much clearer the case. One more skill, this is correct misunderstandings or misinformation. Sometimes clients hold inaccurate notions about the etiology or effects of a disease, which can affect their behavior toward treatment and adversely impact on their recovery. Providers should determine a patient's understanding of his or her problem and politely correct any misconceptions their client may have. For example, a provider might say, while many people believe that taking the birth control pill right before intercourse will be effective, that's incorrect. You need to take the pill every day, whether you are going to have sex or not. Providers should be careful not to make their client feel uneasy or inadequate for having inaccurate ideas or information, and should strive to educate by providing appropriate information. One more important skill is to use appropriate vocabulary. Providers should avoid using jargon or technical language when speaking with patients, making instead every effort to use terms that are meaningful to patients, because patients are not educated in medicine and necessary to speak in this language which is understandable for them. For example, instead of asking, have you had any respiratory difficulties lately? The providers might say, have you had any difficulty breathing lately? And it's much clearer for the patient. Or tell me about your breathing. One more important skill is to present information in separate blocks. It is important to present information in a way that the patient can easily absorb and remember. Providers should explain the diagnosis in a clear and comprehensible fashion, never in a condensing or patronizing manner. Subdividing information into separate categories may help this process. Presenting separate blocks of information sequentially enables the provider to monitor for understanding and absorption before moving on the next block. This kind of presentation helps patient internalize the information presented and enhances the likelihood of effective compliance with the treatment prescribed. For example, the provider may address and sequentially convey brief information on the following topics: name of the disease and its etiology. The next block, recommended treatment for the patient. The next block, ways to prevent recurrence of the disease. Then the other block, other relevant information. One more important skill is to use visual aids and or printed materials when possible. Because when conveying information to patient on disease, preventive or treatment programs or medical devices, it is often helpful to refer to a visual display. Patient cannot memorize everything, and especially if it is some very specialized or detailed information. Visual aids help patients better understand and remember the information provided. It is also helpful to make use of pamphlets with simple text and pictures about important health problem, their prevention, and their treatment. One more recommendation is to recommend concrete behavioral changes to the patient. It means that after making a diagnosis and prescribing a treatment regime, providers may recommend certain behavioral changes to their patients that would prevent the illness from recurring. These recommendations should take into consideration the patient's ability to implement them. Rather than simply emphasizing the end results of the behavioral change, providers should identify and suggest specific steps in the behavioral change. For example, instead of telling a hypertensive patient that he needs to lose 30 pounds, the provider might say, I'd like you to try to lose some weight by taking a 20-minute walk every day and cutting down on the amount of sugar and oil you eat. And it is much more helpful mode of informing. It is also helpful to select an acceptable and feasible treatment. It means that to the extent possible, provide the patient with a range of treatment options from which to select the one he or she prefers. For example, in providing family planning services to a mother, discuss available options and help her select the one that is best suited to her lifestyle. Conditions such as pain management, weight loss, etc. may have a number of treatment options from which the patient may choose something what is best for him or her. The next skill is motivate patients to comply with treatment. Once a treatment has been mapped out, the provider should try to motivate compliance with the treatment prescribed by pointing out to the patient the importance and benefits of such action. For example, in prescribing antibiotic treatment, a provider might say, it is important for you to take your medicine 3 times a day until all the pills are gone. You may feel better after a few days, but if you don't take all the pills, the illness will come back, and it may be harder to cure the next time. One more skill for summarizing is also important for organizing communication. It means to restate the diagnosis, treatment, and its recommended steps in more simple terms. In summarizing, repeat only key points. For example, a provider might conclude a counseling session by saying, I think you have a respiratory infection. Take these antibiotics with every meal until they are all gone. I'd like to see you again in 2 weeks to make sure you've completely recovered. The next practical skill to check for understanding and absorption. Necessary to ask the client to repeat or describe the treatment instructions. Then clarify any misunderstandings the patient might have and find out whether there are any reactions, whether there are any reasons that would impede the patient's compliance with the prescribed treatment. For example, a provider might say, just to be sure you understand how to take your medicine, would you tell me how much and how often you'll take it? One more skill is given additional questions. It's necessary urge patients to ask any additional questions they may have on their current or any other medical problem. It is important to allow ample time for a response and avoid missing the opportunity to consult. For example, if prompted to share any additional health concerns, a mother seeking care for a baby with diarrhea may mention that she is interested in exploring birth spacing techniques, or that she is not sure of the vaccination schedule for another of her children. And it is also important. The next skill, to confirm follow-up actions. It is good to remind the patient to the next appointment date or of the next treatment action he or she will need to take. Remind the patient what to do if symptoms persist or worsen, and about danger signs that indicate he or she should seek prompt medical assistance. These important communicational skills will help you to avoid a lot of conflict situation and to improve trust and beneficence for the client. Important item is tagged in dealing medical professionals. The relationship between and among healthcare professionals has at least 3 roots. A root of social contract relying on a mutual prescription of interpersonal obligations, as well as upon profession, a route developing out of the historical tradition of society and profession, and a personal root that gains its strength from the unique relationship produced by an interaction of the various personalities. Patients as well as the different personalities of members of the healthcare team. And these three roots nourish a relationship that has found expression in three basic models, first described by Schasch and Hollander. These essentially behavioral models, named as activity passivity, guidance cooperating, and mutual participation, coexist with and flesh out the more attitudinal, paternalistic, scientific, interpretational, and lately interactive models. The root of social contract is expressed, on the other hand, in the immense privileges and power given to physicians, and on the other hand, in the high and often unrealistic expectations communities have to physicians. Physicians enjoy high status, special prerogatives, unusual rights, and ample material reward. Physicians strip strangers, administer positions, inflict wounds, and hold legal power over determining life and death. Communal expectations are expressed in the community's view of professionals in general and the medical professional in particular. Skills, whether technical or intellectual, are merely the instruments and not the essence of a profession. To be a professional implies a willingness to use requisite skills in a manner consonant with the moral ends implied in the contract. Technical competence is the necessary condition without which the act is fraudulent, but it is insufficient to describe the professionalism implied in the social contract. Beyond a willingness to perform the technical act is the willingness to participate in and to guide the choice. Social contract then binds all healthcare professionals to technical competence as well as to moral discretion, and it enjoins them to use both. The important guidance for appropriate medical practice is possible to obtain from recommendations of World Medical Association. The World Medical Association is an international and independent confederation of free professional medical associations, therefore representing physicians worldwide. World Medical Association was formally established on September 18, 1947, and has grown in 2013 to 102 national medical associations and more than 10 million physicians. Also in Ukraine, we have representatives of the World Medical Association and scientific conferences, meetings, and publications from these organizations. The World Medical Association provides a forum for its member associations to communicate freely, to cooperate actively, to achieve consensus on high standards of medical ethics and professional competence, and to promote the professional freedom of physicians worldwide. The World Medical Association is active in several areas of action, but mainly in advocacy, ethics, health systems, human rights, public health. In what concerns ethics, the World Medical Association has various declarations, resolutions, and statements with which tries to help to guide national medical associations, governments, and international organizations throughout the world. The World Medical Association also works on medical education improvement, human resources planning for healthcare services, patient safety and patients' rights, leadership and career development for medical specialists, advocacy for physicians and patients' rights, occupational health and safety and disease prevention, epidemic prevention, democracy building for new medical associations, also public health policy, projects such as tobacco control, immunization, and variable other initiatives. Ukrainian Medical Association aims and objectives of the has such aims and objectives of the association. First, to assist to protection and strengthening of health of people of Ukraine, development national medical sciences, participation in deciding medical questions, assistance professional growth, medical employees, satisfaction of legitimate social, economic, of creative and other general interests. The tasks of activity of Ukrainian Medical Association is assistance moral to the cultural and national renaissance of Ukrainian physicians and all people in Ukraine, to increase the state and public significance of the profession of physician, to assist to the improvement of level and qualities of medical service in the country, to assist to the growth of the professional level of Ukrainian physicians, also organization and participation in implementation of scientific researches of actual problems of medicine and public health, advocacy of the interests of members of Ukrainian Medical Association, and the main activities of this organization includes organizing the Congress of Ukrainian Medical Association, organizing variable scientific conferences, the Congress of World Federation of Ukrainian Medical Association, participation in sessions of Public Council of the Ministry of Health of Ukraine, participation in sessions of Advisors Council of the Committee of Health of Ukrainian Parliament, named as Verkhovna Rada, and the medical ethics as a guidance for patients' rights. Actually, this is important sphere of medical ethics. In recent times, medical ethics has been greatly influenced by developments in human rights. In a pluralistic and multicultural world with many different moral traditions, the major international human rights agreements can provide a foundation for medical ethics that is acceptable across national and cultural boundaries. Moreover, physicians frequently have to deal with medical problems resulting from violations of human rights, such as forced migration and torture, and they are greatly affected by the debate over whether healthcare is a human right, since the answer to this question is any particular country determines to a large extent who has access to medical care. These actually questions cause a great importance of the human rights. Medical ethics is also closely related to law. In most countries, there are laws that specify how physicians are required to deal with ethical issues in patient care and research. In addition, the medical licensing and regulatory officials in each country can and do punish physicians for ethical violations. But ethics and law are not identical, and actually in each country there are some specialties of that, and you need to know about the special medical law in that country where you will have practice, because it is not similar, it is not identical. For instance, in Ukraine and in your native country, maybe some differences. So you should explore this question separately. And since publication in the 1999 Institute of Medicine report to Error in Human, intensive national efforts have focused on how providers and management can identify and implement error reduction strategies in hospitals. According to that report, an error is defined either as the failure of a planned action to be completed as intended, and it may be the use of a wrong plan to achieve an aim. This is error of planning. In order to provide safe, ethically attuned care, a growing number of public, governmental, and private entities have encouraged healthcare providers to adapt a system approach to patient safety. Advocates suggest that a system approach helps good caregivers give good care. Such an approach defines error, fosters the recognition of error, and promotes open discussion of error and prevention strategies. And patients, healthcare providers, and the systems in which they work all benefit from such disclosure of information. Studies show that disclosure may help patients get treatment to offset the results of an error, may avoid them, fair comprehension, and may help restore trust in the healthcare provider. Actually, the humanistic approach requires to discuss the medical error, first of all, in medical teams, and to work out common strategy to prevent in future such problems. And this includes also express regret, explain the nature of the error, explain the proximal cause, explain the known consequences for the patient and the potential or anticipated consequences, explain any actions taken to treat the medical error, identify those who will manage the ongoing care of the patient, discuss any planned investigation or review of the error, explain who else has been or will be informed of the error, identify actions taken to identify system issues that may have contributed to the error, discuss who will manage ongoing communication with the patient, provide the names and phone numbers of individuals with whom patients and families can address concerns and questions. Also, it is important to explain how to obtain support and counseling regarding the error, to explain that any charges directly related to the error will be removed from the patient's account, and offer a commitment to assist the patient and his or her family in identifying resources to help obtain compensation if actual damages were warranted. That's all for today. Thank you for attention and goodbye.